Hello, everybody, and welcome back to the Bryan Laskin podcast. I'm excited that you're here. And, we have a special guest today. We haven't had a lot of special guests on the podcast recently, so I'm super excited to have Josh DeVries, who is the co-founder and CEO of Intiveo, a patient engagement software company that helps dental practices increase production and create trusted patient experiences. Josh has over 20 years working with dental practices, DSOs, and academic institutions to streamline their processes and recover revenue. He brings a breadth of experience and unique perspectives on how practices can achieve success. And it's great because, Josh, we're kind of like two peas in a pod. We have the same kind of focus. We're both trying to figure out how to help dentists leverage technology and DSOs and groups to grow their practices. So thanks so much for being on the podcast.
Thank you for having me. Wonderful brief, a little bit humbling, but I appreciate it. Super excited to be here and chat with your audience.
Well, let's dive right into it. I mean, most of the people who listen to this podcast are running DSOs or they're running group practices or they're in dentistry. And you, like me, believe that technology is a great way to grow practices, right? Mm-hmm. So just kind of overarching, what do you feel is the state of the industry? And if you're talking to practice owners now, where should they be pointing their focus?
So I think we are at a seismic shift. There's a deflection point today in the industry. And I think there's a deflection point with technology that we're seeing, where it used to be going digital, going paperless for the last 20 years was kind of the mantra of my career to date. Now it's about leveraging the new technologies, leveraging AI and getting more out of your team members, getting more from your practice, and then be able to provide your patients with more accessibility to new features and new opportunities. But I also think we are in a shift in the economic environment. And I think we're seeing costs obviously go up. We're seeing, staff costs go up. And we're not necessarily seeing fees go up at that same rate. So, so some of the things that you've talked about in the past here is like, this is either an opportunity for us to cut back, which is never something I'm super excited to do, or it's an opportunity for us to lean in, because when things change, there's opportunity. And I think with AI, there's a huge amount of opportunity onto using it correctly, not using it like everyone else is using. But also in the economic environment, there's opportunity for you to gain trust, to gain rapport, and to really level with your patients in an authentic manner, to help make sure they understand the importance of what you're presenting to them, whether it be a root canal, a filling, or even an implant. I think there's a huge amount of opportunity because there's so much change happening in our space today.
Totally agree. Yeah. Well, I think we should dive into AI in a little bit, and I'm sure it seems like that's what everybody wants to either talk about or ignore people talking about. So let's put that pin in that for just a minute. But I want to talk about you brought up something that I haven't been talking about on the podcast for a while, but like 5 years ago, I talked a lot about. And it's funny because the more I think about it, I'm always like, my timing's always off by about 5 years. It's like too soon, right? So I start a company, and then 5 years later, people are like, oh, now I understand what the hell you're doing, right? and so it kind of resonates because I used to show slides of a K-shaped economy of how people are either growing up and to the right or they're going down and to the right. And when I got out of dental school and started my career, the variation between practices was fairly low, right? If one practice was going up 10% or 20%, another one might be going up 3, 4, 5%. Very few were going down. But what you said about the economy, I think it's even widened in the last 5 years, where practices are either growing quickly and they like, I don't even know what to do, I'm so busy, or they are going the opposite direction just as fast that the people don't want to talk about. So first, do you agree with that theory? And if so, what's the difference between the two types of practices?
So I think my entire career has been shaped by new technologies that generate value for your practice to sell to your patients. I know we hate to use the word sell, but to provide to your patients. Whether it been, 3D scans, whether it be, new mini implants, whether it be new imaging technology, everything was focused on this is a new thing. If you present it to your patients, you can now have more billables and more services and to grow your revenues. And that really has been what the focus of my entire almost dental career has been. If you go digital, patients can see their x-rays, they'll be more inclined to buy your treatments. And we're now in a shift where I think the narrative is actually on cost savings, on reductions. And that may be necessary because when you're going into growth at all costs mindsets and you're pivoting into, manageable growth or responsible growth, you do need to trim some fat. But I think one of the things that you talk a lot about is it's not necessarily the cuts that we make to our P&L and our operating budgets. It's actually the trust we can instill with our patients in this time. This is not the time to present only the most expensive treatment plans, but to maybe present two treatment plans. You have treatment plan A, which is super functional and going to solve your problem. And then treatment plan B is, more cosmetic, less, same functionality, but now a cosmetic spin. And maybe option C is status quo, leave it as it is. And you kind of take the time to explain what are the fake benefits of this cosmetic one. Yeah, you're going to have a little bit more pride. You're going to have a better looking smile, functionally exactly the same as this one, and present them two different options that maybe meet where their family is in that kind of economic split that we're seeing. So I think, rather than focusing on how do we reduce our margins, how do we, reduce our staff pay, how do we make sure we can get economies of scale everywhere, it's actually how do we actually capitalize on the relationships we have in the door today? Because the easiest revenue to generate is the people that already trust you to come in. Now you need to expand that influence to make sure that you're presenting them the information so they can trust you to take on some of these bigger treatment plans. So I think it's really about doubling down on that patient experience and having a consistency in it. You can't go one day and take all the time in the world and the next day go rush everyone out the door. It has to be a full buy-in. It has to be a cultural approach that you would hire and fire your staff members on their willingness to take the time to discuss these different options. So I think to me, that's the opportunity. That's the opportunity we're focusing on in Intiveo is not necessarily how do we get our foot into the door of 1,000 new offices next year, but actually how do we grow the value that we're already providing for the 4,000 offices that depend on us today? And I think dental offices have to operate the same ways. Like look at your standard operating procedures, look at the leaky buckets, and then try to understand why is there a leak, and can I take a little more time to increase my conversions because you're going to get way more. And I think you said this on a 5% increase in conversions than you're ever going to get in, Sudbury's cuts or, removing staff breaks. So I think it's about, doubling down on the patient experience, doubling down on that consistency of care. And making that the differentiator from your practice because you have a lot of patients who, given the right information, would make the right decision for them.
Yeah, I totally agree. I mean, when you were saying leaky buckets, we do a lot of analyzing those leaks. Like particularly, what we focus on is what percentage of diagnosed treatment turns into collected revenue.
Yeah.
Because the average practice, it's less than 50%, right? So there's a lot of leak in these buckets. And to your point, like what you said, I've been talking a lot about, one of my new favorite sayings, it's easier to lie in Excel than in Word, right?
Yep.
Spreadsheets don't show how you're running your dental practice. For example, they don't show if you're running on time, right? That is, I don't know about you, but if somebody, I've literally told people, like for example, I had somebody who cut my hair. I said, "You're 50 minutes late." I understand that happens, but if it happens again, I'll never come back,
Yeah.
right? Happened the next time, I never went back. Um, it's a sign of respect, and I know that
Mm.
there's things that happen in a dental practice, but when you're talking about technology, and this will lead us into the AI discussion, I think um, technology should be used, in my opinion, to augment that patient experience. You talked about the digital dental transformation, which I totally agree with. We're coming out of there into a phase that I call connected dentistry. But
Mhm.
even when it comes to like CAD cam restorations, where I was, the reason why I got into CAD cam, now I'm totally dating myself, literally 25 years ago. Uh, the reason why I started using CAD cam was I realized if I was a patient, I wouldn't want to come back for a second visit to have this. If I can get it done in one visit versus two, amen, right? And then that's why I obsessively focused on getting my restorations down. When I stopped practicing dentistry, the average crown from the patient scheduled time to when they left with a permanent restoration was 40 minutes, right?
Mhm.
So it wasn't about and at a high level, I might add, right? So there was many things that went into that, including standard operating procedures and leveraging technology to have that experience. Uh, and to your point, a lot of leaders would look at it and go, well, that CAD CAM crown costs the same as a laboratory fabricated crown. So what's the difference?
Mhm.
Right? Have one done to you versus the other, and you know the difference, right? And I think that, based on our previous conversations, I kind of feel like the same type of focus when it comes to AI is what people should be looking at. What's going to transform our team members, but even more importantly, our patients' experiences in a way that positively transforms so that they become more confident in our care. Do you agree?
I completely agree. I think, the conversation used to be how do like and this is where we had kind of that strategic advantage of being in Intiveo, being a patient experience platform, is we were technology your patients got to interact with. So when they interact with technology like ours, and we like to think we were pretty ahead of the curve as far as how we engage with patients, the experience we provided. But when they're doing that, they walk in your practice and they just assume that technology is everywhere. That same level of experience they got that sliver of is in your imaging, it's in your X-rays, it's in your, how you're doing your charting, everything. Where I think now it's the opposite is true. Where they see you're cutting costs is now what they expect everywhere. So if you have one front desk lady and she's answering the phone nonstop, or it's just ringing off the hook, or you have an AI agent taking the phone call, it's like, oh, you're cutting a corner of a human there. I wonder what
Mhm.
other corners you're cutting. So I think, it used to be this idea of you could build a narrative story that we are super high tech. And now you need to build the story of everyone else is cutting corners. And often it's in human cost, because in dentistry, still your number one cost center is human staff time. And where they see it, if it's happening, they just start to wonder, where am I not seeing it and it's happening? And I think there is no bigger miscut than people and staff relationships. Staff and patient relationships are the trust, the bedrock of trust that offices establish. And I think you've talked about is like everyone loves their hygienist. That's not a coincidence. But if you're starting to cut that experience short, if you're starting to replace that experience with AI, with forms, or to remove the personal care out of it, I think people are going to start saying, okay, I see that here and here. Where don't I see it? And I actually want to go to places because I think it's better when humans deal with me. So I actually think there's a huge opportunity for practices to use AI not to cut corners, but to deliver more accessibility. So one of the things we do at Intiveo, not to self-promote too badly, is that we don't do AI, receptionist. Because when patients call your office, we believe they want to talk to a human if you're open. And if you're not, they used to leave a voicemail. Well, today we don't think voicemails are that great. They're kind of inconvenient for the patient, kind of inconvenient for the staff. So that's where we introduce our AI agent. So when the office is closed, you have an AI agent. You can ask it 27 points of reference to you as a patient to get real information about your appointment tomorrow. And then the staff comes in tomorrow and they can see a summary of that communication. Now, the way we do it is we just look at, okay, was the previous experience a human to human relationship? Okay, it should probably stay that way. Now, what can we do the human isn't good at so they can have more of those experiences together? So, it's a long way of saying what used to be you provide technology and people think that's what it is everywhere. Now it's about where are you cutting your costs, and are people assuming you're doing that everywhere?
Yeah, I agree with the example. I definitely agree with the examples that you gave. I think there are spots to leverage technology where humans do it, where they're bad at it. Collections,
Mhm.
scheduling appointments, like through if you can do it through an app, like we do with Care, versus talking to a human, right? Stuff like that. Because I would say I would say exactly what you're saying, except taking dentistry out of the picture. Like
Mhm.
you know, I don't want to call a restaurant to make a reservation. It's a pain, right?
Yeah.
But for some reason, your dental practices are relying on patients calling the front desk now. And it's a pain. So if when you're walking around planet Earth, engaging with other businesses, not just dental practices, totally agree. Like
Mhm.
that's where because I believe it's incredibly important at this moment in time when dental practices are going, the K-shaped curve, like we talked about, to focus on other businesses outside of dentistry, because so the average dentist is not focused on the patient experience today.
Yeah, but we I mean, yes, I view it that way too, Dr. Laskin. It's because we're in the industry, we can't see the forest from the trees. But you have to understand, this isn't a restaurant reservation, although we may view it like that for a patient. This is a health procedure. I actually don't think it's one to one. And I would say, like, if you have an anniversary, like I got engaged to my wife in Hawaii at a restaurant that I'd never been to, read the reviews, and I want flowers, I want champagne, I wanted the whole thing. Now, to your point, I made the reservation online. I was happy to make it online. But if I called them the day before to go over everything I wanted to go down that night, and it was an answering machine, I'd be disappointed. If it was an AI agent, I'd be concerned it's not being heard. I want to talk to a
Totally
human at
agree.
that point. And I think for a lot of people, dentistry is more like that anniversary dinner and less like Friday night social hour. And I think that's a little bit of our bias because we're so entrenched in this industry that we do view it like going out for lunch. But I'm not sure. I actually do think people have more higher anxieties, higher expectations of personal care when they're dealing with their oral health.
I agree to a point, and I disagree to a point. I think I think
Love
it's
it.
somewhere in between, right? I don't, I like if I'm making my hygiene appointment and my wife at
Hmm.
10 p.m. says to me, "Hey, did you make that appointment?" I want to go on and make it and say, "Yes, I did." You know what I mean?
Yeah.
If, however, it's my first root canal and I have questions, then yes, I totally agree. Like I want to talk to a human being. I like the anniversary. So it's the same. I would say it's the same thing as other businesses. If I'm
Yeah.
getting engaged, I want to call, right? But if I'm have a business lunch, I don't want to talk to a human being, right? And getting your teeth cleaned is probably a business lunch. I just
Yeah,
for
I would agree
fun,
with
I
that.
want to get your, something that is coming. I think probably, again, I'm always 5 years ahead. I think it's coming next month, next year maybe, but it's probably 20 years ahead. This one, robotic hygienists, right?
Yeah.
Right now, people are working on them, and I think that this is something that will likely come to our industry. I was going to say before I hang up the handpiece, but I've already hung up the handpiece. But before in the next decade, I don't think it's unreasonable to think that we're going to have robots that can clean teeth, right? And
I mean,
I
robots
frankly,
are putting implants in better and smaller spaces than humans can today. That's a fact.
yeah. But that I think makes a ton of sense. But
Yeah.
let's get back to the hygienist, because to your point, people love the hygienist, but hygienists are, frankly, the wages have gone crazy, right? So I see a pent up demand for robot hygienists if they become available or when they become available. And frankly, I don't even know how I feel about it, right? Because I feel like, there's issues working with humans, right?
Mhm.
There's issues working with robots. Uh, so, do you see this as if today we could snap our fingers and
Mhm.
have, just for the case of argument, you can't replace human beings, but if you could have a robot hygienist that could scale as good or better than the average hygienist,
Yeah.
would this be a net positive, negative, or both for the industry?
I think I think there's probably unintended consequences. I think for sure quality of care, especially to underserved markets, would go skyrocket. I bought an Apple Vision Pro, and the first thing I thought when I put the thing on my headset is like, you could actually do remote surgeries to African villages with robots with this headset because it's so close to reality.
Hmm.
And I think those are the kind of things that opens the doors, that you would now have 24-hour a day care clinics in third world countries that could just make sure all gingivitis is removed from the world. Like, how great would that be? That would be awesome. I think it would be phenomenal. I think the unintended consequences would be that level of care for someone, maybe that treatment is elective, or that treatment that you need to get looked at. So I think there would be definitely some unintended consequences. But I think overall, accessibility to more people is a good thing. I think the world progressing has brought more and more people out of poverty, which is a great thing. Less and less people are starving than they were 10 years ago, which is a great thing. I mean, is now malnutrition now a problem? Yeah, but we're going to solve that. So I think generally speaking, these are net positives. What I do think is, we as professionals, and more importantly, you as a medical professional, have an obligation to be evaluating, and an obligation to be managing, and to be ensuring that these unintended consequences are worth those trade-offs. Because I do think when we go into ways that AI is influencing, radiographs, and how that's taking away from people's ability to spot it consistently with their normal eye, like it's getting people to be lazier. There's some trade-offs, and they may not be all positive. So I definitely, I think overarching, technology is a net good. I think it provides more accessibility for poorer people. And one of the things I think about this world is, like, we have these people in our brains, the Da Vinci's, these Einsteins, and IQ isn't evenly distributed, into one geographic area. We probably have likely killed a Einstein that lived in Africa because we didn't have soap or clean drinking water. And the more that we can drive the average person out of these poverties, out of these kind of really preventable things that we take for granted in North America, the more likely we're going to tap into better brain power to even move the human race further. So to me, I think these are net positives. I think there's definitely some trade-offs we have to be wary of. But I fundamentally think, societies are evaluated how they treat the least of them, not how we treat the best. And I think often these technologies increase the quality of living for the least of these.
I love the idea of like this vision of like somebody in rural Kentucky overseeing an army of robot hygienists in third worlds cleaning teeth and doing comprehensive exams, and that's kind of neat. We're more than 5 years away from that. Yeah, I think it's great. So let's talk about AI specifically. So you mentioned radiographic annotation, which is how I think most people are thinking of AI now. Uh, which is valuable, taking a decay and highlighting it purple, and so people can say, "Oh yeah, it's that's a cavity." I guess is, as I've talked about before, I think that's a very low level usage of AI in this industry. Um, how do you think that if you were a dental practice today, given where the state of things is, where would you leverage artificial intelligence to help your practices?
So I think there's a couple of ways. One way would be actually finding, like, where are my patients coming from and how can I find more of them. AI is really good at asking you questions and drawing analysis from a data set. So if you actually have, like, hey, I'm doing Google ads, I'm doing mailers, I'm doing community events, and you have a database of where you're tracking it, it can drive insights on what's being most successful, what's generating the most new patients. So I think for an operator, it just gives you no excuses to have a really good understanding of your business.
Yeah.
So I think that is a huge part. But I also think, to your point, accessibility to care. And that's really the one area where I am passionate about AI. I'm fundamentally a huge advocate for accessibility, meaning the average person gets better care more available to them. And I think AI provides that, or it can provide that. I do think we need to be weary of where a human does need to go over it. Like, if AI were to read like, one of the things I love is, like, you're doing a radiograph and you're reviewing one thing, but AI can review 30 things you're not even looking for and highlight those to you. And so I think like those are kind of the cool things because we in dentistry are looking in the mouth, and that's a microscope to the overall well-being of the body. I think AI is going to highlight things that we're not even aware of. Like we're doing cancer screenings in the mouth, we're feeling for them in the hygiene checkups, but is there more we could be doing with the same sort of processes and workflows that we're already managing, but we're just feeding that data into AI to highlight, other health concerns. I think there's huge opportunity because dentistry is the only restorative, preventative healthcare cycle. You don't, no, not many people go for a yearly checkup, but most people go for a 6-month checkup for their hygiene.
Yeah, in the U.S., the stats are 1/3 that see a dentist don't see a physician, and 1/3 that see a physician don't see a dentist, and 1/3 that see one see the other. Right. So of
Mhm.
people that see either a dentist or a hygienist, it's sorry, a hygienist or a physician, it's 1/3, 1/3, 1/3, 1/3 both, 1/3 each. And so yeah, to your point, there is. I don't think we're quite there yet because one of the things we're working on at Tooth Apps is the bringing in the medical and dental data so that you can actually leverage AI to make those
Mhm.
conclusions. In fact, we're just going to be doing our first with the state health information exchange to make that possible. So dental practices will have information of the medical record, which I'm super excited about. But I like to think kind of along your lines. When I ask dentists what they think is the way AI is being used the most in dentistry, almost everybody says radiographs, but what you said is used more often. People taking their P&Ls and loading them up into Chat GPT. And I think even more than that is having your patients ask, do I need a crown? Right? Do I really need a root canal? And so if you are a dentist today and you haven't gone and said, what are the top questions that patients are asking you and how should I answer based on your responses?
Yeah,
I would do that right now, right?
100%. And that'll be the biggest impact. Honestly, it's those little things because those are the ones that people resonate with. Are how you deal with them, how you talk to them. I also think fraud prevention is another huge one. AI opens the door that you could actually have someone monitoring your financials. I've been in the industry long enough, Brian. You've for sure been in long enough to have many people you probably know where someone was stealing 20, 40, 50, $80 a day over 15 years. And that is completely avoidable with AI reviewing your financials.
I
No
see
one
somebody
can
every day
be.
in the mirror who's had that stuff happen. Yes, yeah, it is that's a huge one. I totally agree. Um, yeah, well, anything else, Josh, that you wanted to like any tips, tricks for our audience?
I think, this is an exciting deflection point where technology is being introduced. Right now, it's being introduced as software providers, people like myself, into the industry. And I just think I want to encourage people to work with vendors who want to engage with you. You're either going to be a bystander of how your industry moves and evolves, or you're going to be an active participant. And there are companies that want to engage with healthcare professionals to understand how they see this technology impacting the industry. And I want you to get involved. I think this is all of our problem to solve together. And I think the best solutions often come from people closest to the problem. So I really want to encourage people to reach out to their software vendors, see how they're using it, make sure that they can, support those groups, that they can help influence this technology because it's either going to be used the complete wrong way, either ignorantly or for other reasons, or it's going to be a tool that will make nothing the same ever again. And I do think it has the potential to be the latter. And I think as an industry, someone who's passionate about dentistry and has been in the space for 20 years, I want to see that shape the lives of patients because if not, it's just going to reduce the costs of dentistry. And I think profitable dentistry, although maybe necessary, it's not very aspirational. You know, Providing dentistry that delivers great patient experiences that resolves clinical problems is really what I think we should be focusing in on. And if we take this AI technology and we apply it to that, we're going to have great solutions for the future. So yeah, I just want to encourage people that you are the brain children of these great ideas of how we leverage this technology and to get involved. Don't
the only thing you said there, I gotta touch on is profitability in dentistry. I think right now practices are being hammered, and you cannot invest in technology. You can't have the best experience if you don't have cash confidence, as Dan Sullivan says. So I think that having a successful business is essential to having the best care possible.
completely agree.
So, right. So, I mean, that's,
The question is, why do you want to be profitable? Do you want to be profitable because it's what keeps you in business, or do you want to be profitable to make more money? And I believe, as a salesperson in the dental industry for the last 20 years, we've talked a lot about being profitable to make more money and to reinvest and grow the business, not necessarily to provide better care. And I think we are now at an opportunity where technology is going to greatly go one way or the other, and we need to be on the providing better care train.
Gotcha. Yeah. That makes sense. Well, Josh, thanks so much for being on the podcast. Very much appreciate it. And
thank you for having me.
Thank you.
All right. Have yourselves a great one. And hopefully we can chat again soon.